Assalamualaikum. My name is Muhammad Syahir and you can call me Syahir. My group members' name is Taqiudin, Fahmi, Iman, Haziq and Akmal, Hamizan. We are going to present about importance of maintaining a healthy heart. Since 2005, heart disease remains as one of the main causes of death among Malaysians. This problem is related to their habits and lifestyle. Besides that, we also like to present about importance of blood donation. Blood every day blood is needed to save life. Blood is required for surgery, accidents victim, or to treat patients with leukemia, hemophilia, and other illness. That's all from me. I would like to pass to my friends to continue this presentation.
Today I am going to explain about types of heart disease. First, myocardial infarction, also known as heart attack. It interrupted blood flow and damages or destroys part of the heart muscle. Next is pulmonary stenosis. An infant with the disease can turn to blue. Open heart surgery may be performed to prevent this disease, and it becomes hard for the heart to pump blood from the right ventricle to the pulmonary artery. Next is arrhythmia, which can be fatal, and it is affected by the irregular heartbeat. The ways the heart can lose its regular heartbeat is by tachycardia, which the heart beats too fast, bradycardia, the heart beats too slow, premature ventricular contractions, which is additional and abnormal heartbeat, and fibrillation, which is heartbeat is irregular. Next is congenital, which is present deformities that are since birth. The examples are like septal defects, obstruction defects, and cyanotic heart disease. Next is coronary artery disease, which causes the heart to receive less oxygen and nutrients. It is damaged because of plaque deposits that contains cholesterol. Next is dilated cardiomyopathy, which the heart chambers become dilated and usually affects the left ventricle. Okay, now I'm going to explain the characteristics of blood donors. Okay, first, the blood donor should be between 18 to 65 years old and over 51 kg in weight. The donor's heartbeat must not less than 12 grams per deciliter. The blood donor must not have any major operation in the last 6 months, no blood donation in the 6 months, last 6 months, no blood transfusion in the last 12 months. And if the donor is woman, she must not be pregnant within the last 12 months. The donor must not also have clinical malaria in the past 1 month, and the donor must free from severe hypertension, splenomegaly, hepatomegaly, bleeding disorders, and allergies. That's all for me. Thank you. Assalamualaikum.
Tiga. There are causes of heart disease. Heart disease is caused by damage to all or part of the heart, damage to the coronary arteries, or a poor supply of nutrients and oxygen to the organ. Some types of heart disease, such as hypertrophic cardiomyopathy, are genetic. This, alongside congenital heart defects, can occur before a person is born. There are a number of lifestyle choices that can increase the risk of heart disease. These include high blood pressure and cholesterol, smoking, overweight and obesity, diabetes, family history, a diet of junk food, age, a history of preeclampsia during pregnancy, and staying in a stationary position for extended periods of time, such as sitting at work. Having any of these risk factors greatly increases the risk of heart disease. Some, such as age, are unavoidable. For example, once a woman reaches 55 years of age, heart disease becomes more likely.
Assalamualaikum warahmatullahi wabarakatuh. Now I'm to share you about ways to prevent heart disease. First, stay at a healthy weight. Being overweight or having obesity can increase your risk for heart disease. This is mostly because they are linked to other heart disease risk factors, including high blood pressure, high blood cholesterol, and diabetes. Controlling your weight can lower this risk. The second, get regular exercise. Exercise has many benefits, including strengthening your heart and improving your circulatory system. It can also help you maintain a healthy weight and lower cholesterol and blood pressure. All of this can lower your risk of heart disease. Last, do not smoke. Cigarette smoking causes blood pressure and give you a higher risk for heart attack and stroke. If you do not smoke, do not start. If you smoke, quitting. Smoking will reduce the risk of your heart disease. Thank you, that's all from me.
Assalamualaikum. Today I will talk about how to cure heart disease. There are two ways apparently to cure heart disease, which is the first is medication. A very wide range of medication is available for the majority of heart conditions. The main medication in use are statins for lowering cholesterol, aspirin, clopidogrel, and warfarin for preventing blood clots. The third one, beta blockers for treating heart attack, heart failure, and high blood pressure. The fourth is angiotensin, which is to converting enzyme inhibitors for heart failure and high blood pressure. The second way is by doing surgery. Heart surgery is an intensive option from which it can take a long time to recover. They can be effective in treating blockages and heart diseases for which medications may not be effective, especially in the advanced stages of heart disease. Heart transplants are another option. However, it is difficult to find a heart with the same size and blood type in the required time.
There are criteria to be a blood donor. First, be between 16 and 60 years old. Generally be in good health, weight at least 45 kg, have a hemoglobin level of at least 12.5 g per dl, not have any symptom of infection for at least 1 week. For example, sore throat, cough, runny nose, and runny nose. Not have had a fever in the last 3 weeks.
Assalamualaikum warahmatullahi wabarakatuh. Now I'm to present about issues related blood donation. First, reason why donating blood is important. First, a single donation can save 3 lives. Second, blood cannot be made, so donation are the only way we can give blood to those who need it. Last, maybe someday your friend or family may need your blood. Advantage of blood donation. First, waste loss. Regular blood donation reduces the weight of the donors. This is helpful for those who are obese and are at a higher risk of cardiovascular disease and other health disorders. However, blood donation should not be very frequent, and you may consult your doctor before donating blood to avoid any health issue. Second, stimulates blood cell production. After donating blood, the body works to replenish the blood lost. This stimulates the production of new blood cells and in turn helps in maintaining good health. The last, burns calories. Donating blood burns up to 615 calories per donation. Last, disadvantage of blood donation. A person can experience some side effects as a result of donating blood. This includes: first, dizziness; second, feeling faint; third, arm pain; fourth, numbness; and last, tingling. This symptom will be repeatedly within 3 days. Thank you.
Methods of handling and storing donated blood. First one, use new needles for each donation. Second one, most whole blood donations are spun in centrifuges to separate it into transfusible components. The first one, red cells, second one, platelets and plasma. The third one is a dozen tests are performed to establish the blood type and test for infectious diseases. When test results are received, units suitable for transfusion are labeled and stored. Red cells are stored in refrigerator at 6 Celsius for up to 42 days. Platelets are stored at room temperature in agitators for up to 5 days. Meanwhile, plasma and cryo are frozen and stored in freezers for up to 1 year. Lastly, the transfusion components are used for patients. Thank you.
That's all from us for this presentation. The conclusion is we would like to highlight how importance of maintaining a healthy health in blood donations. That's all from us. Thank you.